My name is Sonali Raman, and I am a fellowship-trained urogynecologist and pelvic reconstructive surgeon at St. Elizabeth Physicians. As a urogynecologist, I get a lot of questions that women may be uncomfortable or embarrassed to ask, but are actually common conditions that many women go through. So one question I often get is, "Doctor, why do I have to pee when I hear water running or when I enter the house?" Both of these are triggers that send signals to the bladder to have an urge to urinate. This is actually called the turnkey phenomenon. So when you enter your house and you turn the door, you know that there is a bathroom 5 steps down the hallway, and your bladder starts to have an urge to urinate. So millions of women visit the doctor for this exact same reason. The condition is called overactive bladder. Any combination of frequency, urgency, and leakage of urine can be classified as overactive bladder. Simply put, overactive bladder is an unnecessary spasm of the bladder. Some women have leakage and some women do not. Of course, this diagnosis is made after ruling out other problems like urinary tract infection or painful bladder syndrome. After the diagnosis of overactive bladder is made, you have 3 different treatment options. The first is behavioral modifications. With this method, you retrain your bladder to not have the urge to go to the bathroom. So for example, you would set your watch to go to the bathroom every hour for the first week. The second week, you'd move to an hour and a half, and the third week would be every 2 hours. At this point, your bladder would be retrained to not have the urge or the spasm. The other component to behavioral modifications are dietary modifications. Many women don't realize that caffeine and artificial sweeteners are bladder irritants and can increase the amount of spasms that your bladder has. So decreasing coffee, even decaf coffee, and any sort of artificial sweeteners or flavored water can help decrease your overactive bladder symptoms. The next option for treating overactive bladder are medications. Most medications would require you to take a pill once a day and sometimes twice a day if you have symptoms at night. Another option for treating overactive bladder would be Botox injections into the bladder wall. This helps to sensitize the bladder receptors to not spasm as frequently. The final option would involve nerve stimulators, either placed in your back or placed on the side of your ankle, that can help send signals to the bladder to decrease the amount of urges that you have during the day. I hope this helps you so that the next time you visit your doctor, you won't feel shy asking the questions you really want to ask.